Yeah,
Okay.
perfectly. All right, so here we go. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. I am very excited to have fellow New Yorker Katiuscia Gray as my guest today. Katiuscia, welcome.
Thank you so much, and thank you for having me.
You're welcome. So Katiuscia is a licensed clinical social worker, certified yoga teacher, and psychotherapist. She graduated from Adelphi University in 2006 with an M.S.W. in social work, and she received a yoga certification in 2018. In 2019, she became a certified clinical child and adolescent anxiety treatment professional. Katiuscia is the owner of Mind Meets Movement Counseling Services, an integrative health practice in Valley Stream. Is it also, you said Lynbrook? Or
So
just
we
in
just
Lynbrook?
expanded to Lynbrook
Okay.
literally a couple of weeks ago.
Okay. So it's in Lynbrook, Long Island. It focuses on individual, children, adolescents, young adults, and families. She and her team utilize unique and creative methods to help clients get the most out of their sessions, linking mind and body in the process. All right. So once again, thanks so much for taking the time to do this.
Thank you for having me.
You're
I
welcome.
adore your podcast. So
Oh,
I'm
I
very
appreciate that.
excited to be here.
Awesome. Well, let's talk a little bit about that. I mean, not my podcast, but so you initially heard the podcast and you were like, I'm wondering if he's going to have me on the guest. So what was why did you want to come on the podcast?
So my whole goal in this journey that I'm on of self-healing and reflection, particularly since the pandemic, is to make more people aware of what healing looks like, what this healing journey looks like, right? I'm a woman of color. In my community, most people think healing looks like, I'm not even quite sure what they think that it looks like, right? I hear crazy stories that, I'm sitting on the couch and, you're judging me, and therapists don't often look like me, et cetera, and et cetera, and et cetera. So my whole journey, my whole healing journey, my whole reason for being here, in my personal opinion, is to show people and to tell people, first of all, I'm a psychotherapist. I come from the exact same neighborhoods most of the people that I treat come from, right? I've probably gone to similar experience that most of the people that I treat come from. I just got more tools and more knowledge, and I'm on this other side of the fence to tell you and show you what healing looks like. And it looks like you, it looks like me.
Awesome. All right. So let's kind of back into that in a sense. How did you get to that point? What was your journey like?
So I have not had an easy journey. I come from a lot of childhood trauma. I come from a lot of really difficult domestic violence. I watched my mom get physically abused for many, 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 many years. There is a lot of alcoholism in my family as well. Not so much drug addiction, at least I don't think so, but a lot of alcoholism. My mom remarried. My dad was an alcoholic, and a heavy, heavy, heavy smoker. She left him. She got with my stepfather, who was, I, the only words that I could describe it was being a monster. He was an alcoholic. He was physically abusive. He was sexually abusive. So growing up in all of that and all that trauma, right? It does something to you. It does something to you. It stays in your body. It stays in your nervous system. It stays in your mind. My mom decided not to leave him. I don't know why. I was subsequently removed from CPS and was placed to live with my grandparents, who essentially had a big rearing and raising me. And my grandparents were very, very Catholic. My family's from Haiti, so they were very, very Catholic. And it never really resonated with me, that Catholic, and nothing is wrong with that. It just never resonated with me because it was thrown down my throat so much. I wanted to find my own journey. And so because of all that trauma, me growing up as a teenager, I was always hyper vigilant. I always thought somebody was coming for me. Somebody was after me. I was always upset. I was always angry. I was always quick to go to 100. I was always fighting. I was always aggressive. And it was because I was traumatized and I didn't have the language to say to people, I'm hurt, I'm in pain. What this person did to me, what this person did to my family has traumatized my total existence and I need help. And the people around me didn't have the language. They would just say, she's a bad girl, just let her go off and do X, Y, and Z. And eventually I did. Even though I was a great student, I was still traumatized, super traumatized. And it wasn't until, I'm going to say, my 20s until I said to myself, there is something going on with me. This is not a normal way for me to live my life. This is not normal. What do? I didn't know anything about therapy. No one in my neighborhood knew anything about therapy. It was a guidance counselor at school that said, maybe you should go see a therapist. And I was like, therapy? What do we think about therapists, right? That they don't look like us. They're not going to really understand me. That was the interpretation that I had. So when I went to see my first therapist, it happened to be an older white man, and I just was not feeling it. I was like, no, I'm not. I don't think so. I don't think this is for me. Lovely man. I just didn't think it was for me. So then I didn't go back. I continued to have that hypervigilant sense that someone was after me. I was always upset. I was always emotional. And then I had my son. And what I noticed is part of this healing journey, when you have children, children often have a difficult time regulating their own emotions, right? So if you're a parent and you can't regulate your emotions to help this kid, it's going to amplify things times 10. So things got amplified after I had my son times 10. And I was like, I need some help. This is not working. And then I went back and got another therapist who wasn't a woman of color, but she was a non-woman of color, she was lovely. And she's the one that really gave me the language to say, you've experienced trauma.
How did she do that?
She really just gave me so much psychoeducation on the brain, my body. She made connections for me with your mind whenever you hear smoke. So for example, my stepfather was a really big smoker and he was a really big drinker. And I didn't realize whenever I was around someone who smoked and was around someone who drank, it triggered me. It instantly brought me back to him, instantly brought me back to all that trauma. I didn't know that. So my response would be, I need to fight. I need to fight. Somebody is coming for me, not realizing that it was the little girl that was traumatized, it bringing me back to that place. So she gave me so much psychoeducation on the brain, my triggers, my trauma, him, my sexual abuse, my mom's history. She just gave me so much psychoeducation that I really, really appreciated it. I want to just fast forward into a little bit because I stopped seeing her because I thought that I was doing well and I didn't feel like I needed to see her anymore. And even though I had a greater understanding for my trauma and she gave me some strategies, I still felt hypervigilant. I still felt like it was stuck in my body. And what started to happen is I started to develop these unbelievable migraines. And I went to the doctor because I was like, there's something wrong with me. I'm having really bad migraines to the point that I can't sleep at night.
Wow.
And she ran all these tests and test after test. I came back to her trying to get the results of the test. And I legitimately thought I had cancer because I was like, there's just no way that I can have migraines like this and it not be something serious. And she was an amazing doctor. And she said to me, there's nothing going on. All your tests came back negative. And I was like, what? What the hell is wrong with me? What's wrong with me?
Right.
And she was like, you're probably stressed. Are you stressed? Like, stress? What are you talking about? Stress could really do that to you? That doesn't make any sense. Are you sure? She was an amazing doctor. She told me she thinks that it's stress. She talked about my own history. Have I experienced trauma? Which really doctors should talk about a lot more. She asked me questions if I have ever experienced trauma. I shared a little bit about my trauma history. And she is the one that also said, it probably is stuck in your body and in your mind,
Wow.
right? So second person to tell me this. And I was like, okay, but I already went to therapy. What do I do now? She was like, you should take a yoga class. And I was maybe 27, 28. And the idea that I had of yoga, and no offense to anyone in your audience, was a skinny 80-pound white woman doing head on their head.
Well, I think that's fair to say. I mean, most people have that opinion for a reason.
Right. Because that's what you see. That's
Right.
what you see on TV. That's what you
Right.
see in advertisements. And so when she said that to me, I was like, I'm not doing that. That sounds like the most ridiculous thing. I don't know how to do headstands. That's not my thing. And she convinced me to give it a try. And the yoga that she recommended was restorative yoga. And restorative yoga is not a lot of moves. It really is just props, and the lights are dim. Sometimes they have candlelight. Sometimes they give you holistic oils. And it's really light, small movements, but it focuses more so on the breath and calming yourself down and making connections with your mind and body. And Guy, the class was 45 minutes. When that class ended, first of all, I was only one of one person of color. So that was A. But when that class ended, I never felt so relaxed in my entire life.
Wow.
In my entire life. And I said, whatever that was, I need more of it. I need more. And people in the world need to know what yoga really does and what it actually is. And then I just became on the journey of, I need more yoga. Now, what do
Wow.
I do with it?
Wow. How awesome. Okay. So, how old were you at this point? Were you in school at this point?
So at this point, I was already done with grad school.
Okay.
And I had my second daughter my second child. I had a daughter at that time. So I'm going to say 31, 32, around that age range.
Okay. So, were you a therapist at this point?
I was a therapist at
Okay.
this
So, you were a
point. Yep.
therapist at this point. And when you decided to be a therapist, what was your goal in doing that?
My goal for therapy was really to help people make greater understandings for themselves. I always say the same line that I use with all my patients when they first come to me is, we need to understand why you move the way that you move. Why does X correlate with X and Z, right? Why do you get triggered so often? Why do you get anxious so often? It's connected to something. It's connected to something bigger. We just need to uncover and unpack what that actually is for you. And I really wanted to, I work with everyone, but my goal and my passion was really to work with people of color. I wanted to work with children. I wanted to work with families, because families, there's this misconception with children that they don't have any problems. And it happened to me when I was in that phase of being angry and upset. Everyone just thought, this is just the way that she is. She's
It'll
always
pass.
like
She's resilient. Right.
she's resilient, she's okay. Not even thinking to say, are you okay?
Mhm.
Are you okay? You've had this traumatizing thing happen to you. You're not with your mother. You're not with your brothers. You are now living with your grandparents, and you have been removed from your family. Are you okay? No one never asked me that,
Right. Wow.
which is amazing,
Right.
which is really crazy when you think about it, right? And I really wanted to give the space for families and kids to understand kids have stress as well, and kids have problems as well.
Right. Yeah, I love what you're talking about here, and I love your mission, and I love your energy, and it really feels, Katiuscia, like you have a purpose.
Mhm,
You really do.
mhm.
Um, and it's really inspiring. I mean, the whole, you talked about, y- people of color and people of color feeling that, and again, rightly so, that therapy is a certain way. It's for certain people. Therapists are certain people. They're not going to understand me. How do you work with that when your clients come to you? What do you do to, I don't know, challenge that belief in a sense?
So I could say this, I don't have to sort of give much psychoeducation or challenge that sort of thought, because the majority of people that call me is, this is bigger than myself and I need help. I need help. And so now that I know that I've reached my bottom and I need help, I just need to find the right therapist. And I just want to
Hmm.
know if you are the right fit for me. So it kind of always starts with that. Because I don't work with mandated people. I work with just self referrals, referrals from the community, people finding me on the internet, online, wherever they find me. So when they come to me, they automatically want to work. What's interesting is the still stigma, just because I'm a woman of color, they still kind of think I am not of them. I am not them per se. I am still this therapist on the other side that has
Hmm.
their life together. That I have one patient who, it's so interesting how what patients think of you. He always says, "You never have any problems. I picture you as Buddha, with all the answers." And I'm like, that is so not true. That is so not true. So I don't really have to do much convincing with that. But what I do make people understand is I'm myself. And so, in myself, in this therapeutic role, I often curse sometimes
Hmm.
because I'm a real life person.
Hmm.
I often call them out on their crap when they are thinking that they can, pull the wool over my eyes. So I'll say things like, that doesn't make any sense, right? So you ready to just tell me the truth? Just tell me the
Right, 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 right. I love it. I love it.
truth.
When you first, so let's talk about kind of an early clinical error in a sense. When you went into this, did you feel, look, you went to graduate school, you got the education, you had this title. Did you feel like, for example, you had to know all the answers, or did you go into it thinking, I need to fix? What, share a little bit about that.
Absolutely. I think we all go through that as new therapists, that I need to fix people. I need to understand everything. I need to do everything that I can to help this family. This is an interesting story. So I said earlier that my family is Haitian descent. And most of the people that come from Haitian descent, at least from what I have experienced, the parents are very aggressive, particularly Caribbean parents, right? They can be very aggressive towards the kids. They could be very ruthless towards the kids. They have no regard for kids. And I'm sure that this happens in all cultures, but
Mhm.
I'm specifically talking about in my culture. So every Haitian family that I've met has essentially always had a story very similar to mine. And I remember I was maybe 27, 28, and I used to work at a clinic. And there was a Haitian family, and I was like, good, this is going to be great because I know this culture and I got it and I know all the answers. And I was talking to the mom and the family and the kid. The kid just had a little ADHD issues, and I was talking to the family and the kid, and I was talking about all of these mean, aggressive issues that I had, that all the people in my community had. And she was like, no, that's not us. And I was like, oh, yikes. So what are you? What happened with you? And she was like, we actually had a beautiful life. We
Wow.
lived in a mansion in Haiti. We had servants. We ate every day. I went to private school. I went to university out there. I got my degree, and I was like, oh, yikes. What do I say? And I felt so guilty because I was like, I'm totally stereotypical and I am making this about me when it's not
Mhm.
about me. And I had to really sit with my supervisor and process, what was that all about? Why do you think I did that? And we really had to sit with that for a bit.
Wow. Wow. So, how did Mind Meets Movement counseling come about?
Mhm. So I had my own practice. I've been doing therapy now for over 15 years. And once I got into yoga and I realized how much it helped me in my own trauma history, I said to myself, wouldn't this be awesome if somehow I could incorporate this in people's psychotherapy? So I started to start out with just breathing and just breath work, right? So making connections for people because in my own journey, like I said, talk therapy took me but so far. I needed
Mhm.
to incorporate the body. And I wanted to make people who suffer from trauma understand as well that we need to incorporate some sort of body work because the mind is connected to the body.
Mhm.
And so I started out with breath work. I started out with breathing and making greater connections between your mind and the body. Sometimes I would give people, let's say, a positive affirmation while we breathe. Maybe we say a scripture that relates to you, something of that nature. And that started working. And then I was like, but I want to do a little bit more. What if we can do some movement, right? And then I started to do movement clearly with people's consent. And then I started to do movement. And I was like, I think that I want to incorporate both. I don't want to just be a psychotherapist anymore. And I don't want to just be a yoga teacher. I want to do both. And so when I created Mind Meets Movement Counseling, I wanted people to understand that if you are coming to see me, we are incorporating both because you're coming to me because you want to try something different. Maybe the CBT and psychotherapy, it's just not enough. And maybe you doing yoga is just not enough. We're going to combine both. And I have to tell you, I have never been busier. I have never been busier.
That's awesome. Let me ask you a question. You
Yeah.
know, you talked about people of color and their attitude. I mean, it's I don't want to generalize, but
Mhm.
their attitude towards therapy. Is that shifting?
Yes.
How
I
so?
I see a huge shift. There's most people of color suffer a lot from trauma, right? And trauma doesn't encompass just physical abuse or sexual abuse. Trauma encompasses abandonment, right? Trauma encompasses poverty. Trauma encompasses drug addiction, drug abuse in your neighborhood, being around all of this violence all the time. And trauma encompasses racial trauma. I mean, my God, look what we just experienced in during this pandemic. We saw a man of color be killed on live TV. Super traumatizing, not just for the world, but for people of color. And I think people started waking up to how traumatic not just that was, but how it triggered them with their own stuff. So I
Mhm.
would get calls from people that would say, this George Floyd thing has just really unnerved me and it's just really traumatizing. But then when they come in and you unpack it, you start to realize all the trauma that they've experienced
Mhm.
and how this one more thing has just exploded for them. So I think mental health is here to stay. I think a lot of people of color are starting to see the benefits. Celebrities are talking about it now, which makes it good. Oprah just wrote a really good book with this physician.
Perry,
It's a great
yeah.
read,
What
great book.
happened to you?
What happened to you? I just downloaded it on Audible. It's a great read. A lot of men of color out here in New York that are on radio stations have been really open and shared about their own mental health history. So a lot of people of color have been really looking for therapy and looking for therapists of color. The problem now is there's just not enough therapists of color. That's the
Mm,
problem now.
mm, wow. All right. So now, do you have people working with you? Do you have a team? What talk about that a little bit?
I do. So it used to be just me, but then I saw how busy I got, and clearly I can't see everybody because I have to take care of my own emotional health. So I just started a group practice. So now I have about 5 therapists that work under me.
Wow.
They're not yogis, but they do practice holistically. So they are taught and they are utilizing breathing and play therapy for the kids. So alternative ways, they're just not yogis, which is fine, which is fine.
Okay. So for the people listening out there, for the people of color listening out there, if it's hard. We all know it's hard to find a therapist that you're going to fit with. How would you advise, let's say, people of color who want to find a therapist to go about doing that?
Mhm. I would say to look online. So Psychology Today is a great resource. There's a filter that you could put woman of color, man of color, your zip code, and it really narrows it down. There's a few more other websites as well. There's Therapy for Black Girls. That's a good site. There's Therapy for Black Men. That's a really good site. There's cliniciansofcolor.org. That's also a good site. And read profiles. Find out if they take your insurance, read their profiles, see if you connect with them from reading a little bit about their profile,
Mm-hmm.
right? And then give them a call, right? Most therapists, we give at least a 5-minute consultation. I know I do, and I know most people that I refer to does. And you just ask them, do you treat anxiety? This is what I've been experiencing for a period of time. I just want to make sure that this is the right fit, and interview your therapist. I mean, it's
Right.
not going to be an extensive interview, but it is going to see if this person is the right fit, because therapy is very vulnerable. It's a very vulnerable process.
Mm.
And you have to be able to have a great connection with your therapist so you can feel vulnerable and can speak about what's going on so you can finally get the help.
Okay. Great advice. So before we wind up, I know we probably touched upon this throughout this interview, but what is it about doing this work that gets you going? In other words, when you're able to do what with a client, when you're able to experience what is it that you're like, you walk away and you go, yes, this is why I'm doing this.
Yeah. So sometimes people will come in and they will be very zippy. And when I say zippy, I mean that they're triggered. Clearly, something happened throughout the day that was very triggering for them. And when we sit down and we have our sessions and I make greater connections for them. So why, when she said this to you, it got you all riled up? What is that about? Let's go back. Let's go back into when's the first time someone made you feel that way, right? And we'll go into the whole story of childhood. Maybe something traumatizing has happened. Maybe an emotional abuse, maybe this, maybe that. So that's one big piece that I love, because their eyes light up because they didn't realize that one thing that my mom did from 6 has
Right.
been following me my whole life,
Right.
right?
Right. Yeah.
So that's one part that I always feel like, yes. And then part 2 is, okay, so now let's sit in that just for a little bit, right? Let's sit in that for a little bit, because you've created this story and this narrative in your head that whenever someone looks at you that way, they don't like you. They're mad at you. They're talking about you. And that's not real. That
Mm-hmm.
is the story that you've created. That is your brain on trauma telling you that that's your mother when it's not. You're just here in this room safe with me. So let's do a little breathing exercise. And then I'll say something like, put one hand on your heart, one hand on your belly, and feel your body, feel the sensations, because this lets you know that you're here and you're present. And then I'll say, close your eyes if that feels comfortable, and then just breathe in through your nose and exhale it out. And when we exhale, we sigh it out so we can let out all the stress and all the anger and all the depression. And we do that for a few minutes, and then we open our eyes and we come back to present. And I always say, how do you feel? And they go, I, I feel great. What was that? What'd you do? I didn't do anything. We just breathed.
Oh man, I love that.
Yeah.
All right, Kat. Awesome. So as you wind down here, how about a go-to book recommendation, whether trauma related or not, or therapy related or not? What do you have?
My go-to is The Body Keeps the Score. I know that he was on your show. He is my guy. I loved him. I read his book in undergrad. That book changed my life. It really made me have a greater understanding of the mind-body connection. And it's so funny how things always come back full circle. I met him like 5 years ago, and I told him how much his book meant to me, how I got on my healing journey because of him. And he was so lovely and kind. He took a picture with me with the book.
Oh, cool. Very cool. Kat, you are awesome, man. I can't wait to have you back. I'd love to have you back if you're willing to come back. Love your energy and your passion. I mean, this is what this podcast is about. So I'm so glad you listened and you're like, I want to get on that podcast, and I'm so glad you did.
Thank you so much. And thank you for having me. And I do want to say that you can probably put this in your show notes, that I created a small ebook that's free for all of your listeners. They just have to go to my website and type in free ebook. And it's a short 3-page small book where it talks a little bit more about the mind-body connection. And there's some yoga moves in there that has to do with mental health.
Awesome. We'll have that linked up at the show notes page at the traumatherapistpodcast.com. All right, Kat, you are awesome and inspiring. Take care.
Thank you. Thank you for having me.
Bye-bye.